All right. Hello, everyone. Thank you so much for joining the October Wellness webinar, Keeping Your Lungs Healthy. Today, we have a guest speaker, Dr. Chidinma Chima-Melton, a pulmonologist at UCLA. She received her medical degree from Stony Brook University School of Medicine, New York. She completed her training in internal medicine at Yale University in New Haven, Connecticut. She then made the move to the West Coast for fellowship in pulmonary and critical medicine at Cedars-Sinai Medical Center in Los Angeles. During fellowship, she performed research in idiopathic pulmonary fibrosis, a progressive scarring disease of the lung with no clear cause. She was awarded the Sports Spectacular Distinguished Fellow Award for her research, in addition to having her work funded by internal grants. Following her fellowship, Dr. Chima-Melton joined UCLA and is currently a board-certified pulmonologist with an interest in interstitial lung disease, occupational and environmental lung diseases. She also serves as medical director for quality for the Department of Medicine at UCLA Health. Thank you so much for your time today, Dr. Chima-Melton. We appreciate your time and we look forward to your presentation. You can take it away. Thank you.
Thank you, Kristen, for that really kind introduction, and thank you all for joining me this afternoon from wherever you're located. So this is a really interesting talk that's near and dear to my heart, and I've titled it Everything You Ever Wanted to Know About Your Lungs and How to Care for Them. So why don't we dive in, as we have a lot of material to get through. So let's just talk about breathing. Breathing is one of these things we take for granted, and you don't notice that you're having a problem with it until you have a problem with it. And for the most part, it's in the background, it's an autonomous function. So the way we're going to talk about this talk is basically go through and discuss the structure and function of the lungs. We'll talk about some innate risk factors for lung diseases, some modifiable risk factors for lung diseases, and then we'll just go through some common lung diseases in a case-based process, which I find is a really nice way of learning. And then I'll leave you with tips to improve your lung health with each of these. So diving into the structure and function of the lungs, essentially your lungs are made up of your trachea, which is the windpipe, the larynx is the voice box, and then you have your left and right lungs, each of which are connected to the bronchus and bronchioli, which are tree-like structures. So the function of the lung is to basically absorb air from the environment into the bloodstream, absorb oxygen from the air into the bloodstream, and also remove waste carbon dioxide from the blood back into the air. So it serves a dual function. And some facts about the lung. Our capacity, the lung capacity varies with size. So someone who's 6'5" is going to have a dramatically larger lung capacity than someone who's smaller. And exercise can actually help significantly improve your lung capacity regardless of your size. You can have recurrent infections that can reduce your lung capacity by causing ongoing inflammation and scarring. Lungs can be damaged by smoking. And unfortunately, lungs are one of these organs that do not regenerate. Almost every other organ in your body regenerates except the lungs. And finally, where you live matters. Environmental pollutants can definitely hurt the lungs as well. As I'm going through, if you have any questions, just pop them into the chat, and at the end of that section, we will deal with those. So when we think about some innate risk factors for lung diseases, things that you can't control, these include things like being premature if you're born early, having a low immune system, so certain diseases, immune diseases like CVID, HIV, for example, other comorbidities, having diabetes, having cancers, for example. So these are things that are intrinsic to you that can increase your chances of having lung disease. And then you think about some modifiable risk factors, meaning things that can happen to you or you can do to yourself that unfortunately increases the risk of lung diseases. So things like smoking, pollution exposure, weight gain, or even significant weight loss, and then lifestyle factors as well. So with that, let's dive into the cases. And what I'm doing with these cases is going through 7 really interesting lung diseases that are very common. And then we can talk about how they present and how you can actually reduce the risk of getting them. So when we think about the 7 most common causes of difficulty breathing, the first one is pulmonary embolism, which is a clot in the lung vessels. Then there's heart failure, which is interesting because your lungs and your heart are clearly different organs, but nonetheless, reduction in the function of your heart can actually affect the lung as well. So COPD, emphysema, which is a lung disease that we'll touch on, asthma, pulmonary fibrosis, pneumonia, and then VALI, which is vape-associated lung injury, which is actually a newer entity that came about in the last 10, 15 years with the increased use of electronic cigarettes. So let's talk about our first case. And the first case is a lady. These are all fictional names, but they're actually based on patients I've seen in clinic. So the first is Ada, who's a 75-year-old lady who presented with difficulty breathing. So this happened one night. She's lying in bed. All of a sudden, she realized she can't lay flat. She's short of breath. She's wheezing. She can't catch her breath. And the only thing that's significant that she's done differently is that she went to a Chinese restaurant with her daughter yesterday and ate some salty food. So she goes to see her doctor, makes an emergency visit with her doctor the next day, and they notice that she has her ankles. Her ankles are swelling. She can't catch her breath. She's noticed she's gained about 10 pounds in a very short period of time. And she has a history of heart problems. The other thing to know is that she was supposed to be taking a water pill called Lasix or furosemide, but she skipped that morning dose because she didn't want to have to use the bathroom when she left the house. So let's think about this. What could be going on with Ada of the 7 things that I had listed on there? So you can type your answer into the chat. And while you're doing that, I'm going to deal with some of the questions that have come up. So one of the questions here is, please explain your lungs do not regenerate. So the alveoli are made up of cells, type 2 pneumocytes, and essentially these do not regenerate as like other organs do. So the heart, the cardiac myocytes, the muscle myocytes, these are all cells that regenerate quickly, whereas with the lungs, often once they are damaged, the damage is there. So we do have things that clean up damage in the lungs, but essentially once you lose your capacity, it's often very difficult to get it back, especially due to smoking. Okay. So going through, heart failure seems to be the most common answer there. And Gregory Ho says, salty food, too much water on board, swelling ankles affects the heart. That's exactly it. So heart failure is the correct answer. And so what we're seeing is called an exacerbation or worsening of congestive heart failure. And in heart failure, what happens is basically your heart doesn't pump or feel very well. And essentially fluid builds up in the body, builds up in the lungs because there is a backup. Think about it almost like a plumbing getting backed up. And then it backs up into the lungs, and having fluids in the lungs can be life-threatening. This is called pulmonary edema, fluid in the lungs. And it can also build up in the feet and ankles. What you see below in A is what we do frequently in the clinic, where we push on a patient's ankles or feet, and you see it leaves behind an indentation because the foot there is actually filled with fluid. So that's one of the signs we see in heart failure. So how do you prevent this? We know that having fluid in your lung can be life-threatening. So the one thing I mentioned she did was that she skipped her dose of the medication. So skipping the water pill Lasix contributed to this. And keeping an eye on your weight, checking daily weights if you have a diagnosis of heart failure really matters. And then watching how much salt you eat, really minimizing the amount of salt in your diet. Unlike her, she went to a Chinese restaurant, which we know often there's a lot of added salt in there. And then weighing yourself every morning, letting your doctor know if your weight increases by greater than 5 pounds in a day. Often that can be a sign, an early sign that you're retaining excess fluid. So what happened with Ada? She went to her doctor, and her doctor essentially sent her to the emergency room because she was having a hard time breathing. She was treated with Lasix, which is furosemide, the water pill through the IV. She got some oxygen, and she started peeing. She was urinating very well. 4 liters later, her breathing improved. She felt like her breathing was better, and so they sent her home the next day. So she had a good ending. So I will jump on to situation 2, which is Jake. Jake is a 70-year-old man who I met about 3 years ago now. And his symptoms started where he woke up all of a sudden feeling like he couldn't catch his breath. Started suddenly out of the clear blue sky. He also felt like he was having a lot of chest pain. We call this pleuritic chest pain when he tries to take a deep breath in and he found he was limited. He couldn't take a deep breath in. He also had pain and swelling in his right calf, which is unusual. Usually he has no pain there. And the most concerning thing that drove him to my office was that he was coughing up blood. Notably, he had just got back from visiting his son in Australia. So there was a long flight there. So what could be going on with Jack? Again, type your answers into the chat. Is it pulmonary embolism, heart failure, COPD, asthma, pulmonary fibrosis, pneumonia, or VALI? And while you're doing that, I will take a look and see if there are any other questions. Okay, so it seems like the majority of people are saying pulmonary embolism. Ophelia, I see that you were posting something there about your father who was exposed to a poison, hospitalized for days, no real diagnosis, and then having breathing issues. And his latest diagnosis is pleurisy. Do you think his lungs are permanently damaged? Or lung issue will continue worsen or improvements? Yeah, you know, with these exposures, they're very difficult because environmental exposures, it really does depend on the agent that you've been exposed to, and different people respond differently to them. But you know, as a whole, sometimes you have people who get exposed, they get the acute difficulty breathing, and then it persists for a while. And so I think definitely following up with your dad's primary care physician and potentially getting a referral to a pulmonologist to do some more testing to really understand his specific situation is important. But I'm sorry to hear about that with your dad. All right, so it looks like the majority of people there say pulmonary embolism. There's one pneumonia, one heart failure. So in this case, the majority wins. It is a pulmonary embolism. So he went to the hospital, a CAT scan was done, and it showed a clot in his lungs. And you can see this you're not radiologist, but I'll point out what you're looking here on the left. This bright stuff is his pulmonary artery, which is a big blood vessel in the heart. And you see this gray stuff here, which is essentially a clot that's sitting there, preventing blood from leaving the heart. So ultrasound of his legs also showed that he had a clot in the femoral vein. So he was diagnosed with a pulmonary embolism and deep venous thrombosis, which is a very serious condition. The mortality rate for this is incredibly high, and it's really important we have a high index of suspicion for patients, for people who have traveled recently or who've been ill in bed recently as well. For Jake, he was lucky. He was treated with medications to dissolve the clots, and then he was sent home on blood thinners. And about after a week later, he felt better. So for him, seeing as this was provoked, meaning that there was a specific reason why he had the clot, he was able to stop taking the blood thinners after 3 months and has been doing fine since then. So how do we reduce the chance of getting clots? Really trying to stay as active as we can is the big thing, especially in the age that we're all working from, you know, a good amount of us are working from home and spending a lot of time sitting down. So make sure you get up and walk around every 1 to 2 hours. With regards to getting on flights or long trips, do not smoke before your trip. That's often something that we see being associated with higher risk of getting DVTs or deep venous thrombosis. Ensuring that you're wearing loose, comfortable clothes. Shifting your position and then moving your legs, trying to avoid keeping your legs crossed because that can often impede venous return back to the heart. Drinking plenty of fluid, staying hydrated. Compression socks are actually really good as well. So wearing knee-high compression stockings and then avoiding alcohol. So you can see here what a deep venous thrombosis looks like. Normally you have your valve and you have nice blood flow through the valve. However, sometimes when there is injury, that can form a clot. And what happens is this clot essentially breaks off, and an embolus, which is a piece of the clot, travels and gets lodged into veins in the heart. And that's what a deep venous thrombosis, a PE is. So someone has asked, is there any blood test or lab work that can be done to reveal whether there are blood clots in one's body? So that's a really good question. There is a blood test we have called a D dimer, D for dog dimer. It tells you whether or not you're at increased risk of having had a clot because it looks at the products of when a clot breaks down. However, it's not 100% specific. There's a lot of other things that can cause an elevated D dimer level. However, when we see it's high, it increases our suspicion that someone has a clot. And Marlene has asked why traveling would trigger a blood clot. The reason why traveling would trigger a blood clot is because you're sedentary. You're sitting down and you're not moving. And so there are three things that increases the risk of clots. The first is being sedentary. So for example, you've just been really ill and you're lying in bed for a few days, or even traveling, that increases the risk. The second one is what we call endothelial injury, meaning the injury to the blood vessels that releases chemicals that are prothrombotic, that increases the risk of clots. And then the third one is having a procoagulable state, which basically means having something in your body that increases the risk of you forming clots, such as cancer, such as having certain mutations that make your blood clot easier. So any one of these three things, which we call Werker's triangle, will actually increases the risk of your clot. So thanks for that question, Marlene. All right, moving on to situation 3. So situation 3 is Fran, an 81-year-old lady who smoked heavily for 50 years. So she comes in, short of breath, wheezing, coughing. And she notices over the last couple of weeks, she's been coughing yellow stuff up. Her chest feels really tight and she feels she can't take a full breath in. And she's been using her rescue inhaler about 5 times a day and not getting any relief from this. So what could be going on with Fran? Is it a pulmonary embolism, heart failure, COPD or emphysema, asthma, pulmonary fibrosis, pneumonia, or VALI? So again, just type your answers into the chat. Okay. So have a couple of asthma, the majority say COPD, emphysema, 1 pneumonia, COPD, pneumonia. Okay, so it looks like the majority of people say COPD, emphysema, which is correct. Let's see here. And then Christine asks, is being older a risk factor for these conditions? The short answer is yes. We tend to see more COPD, emphysema, heart failure, pulmonary fibrosis in older adults. So the majority is right. She has COPD, specifically what we call the COPD exacerbation, meaning a worsening in her COPD. And what COPD is, it stands for chronic obstructive pulmonary disease. And it's a lung disease that makes it very hard for us to breathe. What essentially happens is your airways become very narrow and damaged, and smoke can damage the lungs essentially forever and cause COPD. So the classic symptoms we see are difficulty breathing, cough, and mucus production, all 3 of which Fran has. And we diagnose this using spirometry, which is a breathing test, or more broadly, PFT's pulmonary function test. So she went to the urgent care and she was given a breathing treatment with a nebulizer. She was actually given a shot of steroids and some antibiotics. And after a couple of hours, she started feeling better. So I've included this X-ray here because what I think it demonstrates really nicely is big lungs. One thing that happens in COPD and also in asthma is what we call air trapping, meaning You inhale in, but you're trying to exhale out and the air gets trapped. You're not able to fully exhale. So you develop what looks more like a barrel chest. You see how the diaphragm is really small, really flattened here, and the lungs look really big. So again, COPD stands for chronic obstructive pulmonary disease. So that obstructive part where you can't exhale out fully is one of the classical things we see with COPD. So how do we reduce the chance of getting COPD exacerbation or emphysema? Essentially stopping smoking. And that is the one thing you can do to really reduce the chance of this happening. So if yourself, family, friends, colleagues smoke, that's the one thing you want to advise them. And then getting a flu shot and a pneumonia shot, the flu shot every 4 and pneumonia shot actually significantly reduces the risk of COPD exacerbation, meaning flares in the COPD, because the vast majority of COPD flares are actually caused by viral and pneumonia, bacterial causes, which trigger the underlying lung disease. So by being protected against this, it reduces the risk of having a flare in the COPD. Also, continue to use your inhalers that you've been prescribed or the nebulizer medications you've been prescribed. And then finally, if you find that you're having to use the albuterol rescue inhaler more than 3 times a day, you're coughing, you're short of breath, you're wheezing, then this is another reason that you need to seek medical attention earlier rather than later. And so on the left here, you basically have the lungs as I described them. The carina, which is where it splits off and to the left and right, the bronchus, which is the tree-like structure, and the mediastinum, which is essentially the center of the lungs. Okay, so before I go on to the next case, we're moving through this as a pretty fast pace. And so I'm going to take some questions. What is an older adult? That is a good question, Adina. The medical definition for an older adult is 65 and over. However, as we have better therapies and medication, healthcare system, I often see 70, 80, 90-year-olds who are very fit and look better than some 50-year-olds. But the definition we talk about for older adults is 65 and above. Marlene says, I have 2 members that always argue about smoking marijuana, and I tell them they'll get lung disease emphysema, and they say they only get sick if they were to smoke tobacco. So that's a really interesting one, and we'll touch a little bit about that. Marijuana for the most part, does not give you emphysema. However, it does cause some obstruction in your airway. So you see something similar to asthma, where you can end up with that air trapping we talked about. So there are certain lung diseases that can be predisposed to you by ongoing smoking of marijuana. And then Gulez says, I'm a smoker. If I quit smoking, will my breathing improve, even though damage cannot be reverted back? So this is another great question. I always tell my patients it's never too late to quit smoking, because yes, there is some permanent damage there, but what happens is the trajectory of the damage changes dramatically once you quit smoking. We all lose lung function as we get older, and it drops off. In smokers, the drop is precipitous. It drops off much faster. If you do quit smoking, that trend, that quick drop off actually flattens out. So you lose lung function at a lower rate than if you had continued smoking. So there's always a reason to stop. Marijuana smoking causing COPD, I think I answered that, which is not specifically, but it can cause an obstructive lung disease similar to COPD. Secondhand smoke danger. Secondhand smoke is a very serious condition. And I have patients, for example, women who've lived with their smoking partners for 30, 40 years, have not smoked a day in their life and come in with really severe COPD as well, and on oxygen. So secondhand smoke can affect adults. In addition to children, there's a lot of evidence that children who grow up in smoking household have an increased risk of lung diseases like asthma, increased risk of bronchitis. So these are all things that you want to avoid. Okay, so I'm going to dive into situation 4, and we'll deal with more questions later. So situation 4 is Tom, a 65-year-old man who's been feeling very tired for a week. He got his COVID vaccine actually in February of this year. But he presents with cough and fevers. He feels breathless, and he has a lot of chest pain from doing so much coughing. He has a poor appetite and he feels nauseous, but he's able to eat and drink. And he also has noticed that he has a loss of smell and taste. So what could be going on with Doug? Is it pneumonia, heart failure, COPD, asthma, pulmonary fibrosis, pneumonia, or VALI? And you can type your answers in the chat. Okay, so I see pneumonia, asthma, COVID-19, Gloria, pneumonia, walking pneumonia. Yeah, excellent. All right, so the answer is pneumonia. And pneumonia, when we talk about pneumonia, what we're referring to is essentially an infection of the lungs, and it can be very serious. The symptoms we look out for are coughing up a cough with mucus production frequently, having fevers, having some difficulty breathing. Sometimes you can have pain when you take a deep breath in. You can have your heart beating quickly, or you can have shaking chills as well. So how do you know it's time to seek medical attention? If your cough keeps getting worse, not improving, you find it's actually interfering with your breathing. A lot of us have these pulse oximeters now where you can actually see what your oxygen levels are. So if you notice your levels are dropping low, low is defined as being less than 92. If you have fevers greater than 102 or higher, so that's considered a high fever. If you're having chest pain, if you had a cold or flu and you were getting better, and then all of a sudden you take a turn for the worse and start getting worse again. If you have a weakened immune system or underlying lung disease, 65 or older, or if you find you're unable to keep anything down, can't eat or drink, then these are times that you need to seek medical attention for it. So looking at this X-ray on the left, these are lungs. Lungs are filled with air, and air is black on the CAT scan. However, you see this density here on the left lower part of the lung. Actually, that's the right lower part of the lung. And this is considered what we call an opacity, and this is very classical for what we see as pneumonia. So this patient has a pneumonia. And what has caused the pneumonia? In this case, it's actually COVID-19. So Gloria, you were correct. Yeah, he was vaccinated, but the reality is he was vaccinated a long time ago now. February. So that's 8 months ago. COVID-19, we're all familiar with, is a coronavirus from the coronavirus family, similar to SARS, which we had to deal with a few years ago. It's transmitted in our respiratory secretions, and it can cause a spectrum of disease from nothing, absolutely no symptoms at all. You have no idea you have it until someone tests you, to having very severe symptoms like a pneumonia, very severe pneumonia. There's something called ARDS, acute respiratory distress syndrome, which is essentially what people die from when they die from COVID. And this is when your lungs become leaky. A lot of fluid leaves your capillaries and actually fill up the lung air spaces, these alveoli, and it makes it hard for gas exchange to happen. So we can't oxygenate you. And that's how people pass away for the most part from pneumonia. So vaccines reduce the risk of serious illness or death, but I have to stress that it's not 100%. You do still have patients who catch COVID and may still get sick from it, but it dramatically reduces the risk. So the fact that Doug got vaccinated, I think, helped him because it reduced the risk causing the pneumonia rather than being a severe pneumonia that landed him in the hospital to being a mild pneumonia. And then we have medications to treat it. For the most part, these are approved in the critically ill patients. So in this case, Tom, he went to his urgent care and he was diagnosed with a mild COVID-19 pneumonia. How did they know it was mild? Because they checked his oxygen levels and they were good. It was about 95%. So he was sent home and told to isolate with close monitoring. His primary care doctor actually reached out to him and got him organized so he could receive an infusion of a monoclonal antibody. This one's Regeneron, essentially, casirivimab. And so he received that the next day. And about 1 week later, he felt much better. He completed his 10 days of isolation, and he's up walking and talking and being great today. So he had a good outcome. And I think that's in part due to his vaccinations. The things I want to take away from this, though, is that despite having been vaccinated, in his case with the Pfizer vaccine 8 months ago, the vaccines, the immunity tends to wear off. And so there is a need for boosters. And the FDA just recently basically approved the use of boosters for all the vaccines earlier on this week. So if you haven't been vaccinated already or received your boosters, absolutely is important to do that. Masking when you're around others is essential. If you do smoke, stopping smoking, I'm going to keep repeating this, is the one single thing you can do for your lungs that will really help out, reducing the risk of infections. Frequent hand washing, avoiding crowded areas, physical distancing as much as you're able to. And then if you do know of someone who's been exposed or you have been exposed to someone with the virus, then isolating while you wait for the results. And then continuing to manage your other medical problems is also really key here. Okay, so how are we doing time-wise? Let's see. Okay, we're doing really well. We can take a little break and see what questions we have in the chat. Okay. So Patty says, what is significance of pulmonary nodules in a 60-year-old after quitting smoking 30 years prior? And how frequently should nodules be checked via CT scan? So this question is actually really important. Despite the fact that you have quit a long time ago, there is still a risk of having, lung cancer. And so we want to keep an eye on pulmonary nodules. It's funny that you put down here 30 years because the cutoff that when we start screening for lung cancer is truly about a 30-pack-year smoking history. And so if you've smoked heavily in the past, and even though you've quit, you might not necessarily meet criteria for screening for lung cancer using the CAT scans. However, if you do have nodules, these are things that need to be followed up. And depending on the size or the look of the nodules, your pulmonologist may want to follow them, on some sort of frequency, whether it's 3 months, 6 months, annually, or maybe they determine that based on the features of the nodule, it does not need to be followed at all. So thanks for your question, Patty. So the next question. I live in an area that has wildfire smoke every year. Smoke gets into my home. I have asthma. I wear a mask outside, but I worry it will cause COPD or lung cancer if I live there yearly with wildfire smoke. Should I be worried? So, Jean, in response to your question, it's unlikely that wildfire smoke is going to cause COPD or lung cancer. However, one thing that it can do is certainly the environmental toxins, that the impurities in the air could certainly trigger underlying lung diseases, an underlying lung disease if you have one. So if you have asthma, that may serve as a trigger for you. But something simple like having a air purifier in your home, specifically in the rooms that you spend the most time in, is important. Catherine has asked, is pneumonia contagious? This depends on the type of organism that's causing the pneumonia. So there are certain organisms that are considered highly contagious. So for example, COVID-19 is clearly very contagious, one of the most contagious organisms we know of. And so, that will be considered contagious pneumonia. However, the vast majority of bacterial causes like streptococcus, staphylococcus, pneumonias are not considered contagious. The other big cause of pneumonia, especially in the developing world we haven't talked about, is tuberculosis, and that is contagious as well. If you've had both pneumonia vaccines and COVID vaccines, can you still get pneumonia? Julie, that answer is yes. You can, because we're covering, the pneumonia vaccines cover a vast majority of pneumococcal pneumonias. And then COVID vaccine obviously covers the virus, but there are a lot of other organisms out there that cause pneumonias. These vaccines reduce the risk because these are the most common pathogens we know that cause pneumonias, but there is still a risk of getting pneumonia. It's just significantly reduced once you have the vaccinations. Is living at high altitude a risk for lung issues? Not necessarily. If you do have an underlying lung issue, it make it difficult for you to breathe, but not necessarily. Okay. So there are more questions, and I will get to those if we have time. I'm going to jump into situation number 5. So situation number 5 is Connie, a 65-year-old lady who's feeling very tired and short of breath for 1 year. So she worked on a cruise ship for 30 years. More recently, she's doing less activity because she tires out very quickly. And she has this persistent dry cough that's remained there for about 8 months. She gets really short of breath when she's walking very short distances, and she's been losing weight unexpectedly. Initially, it didn't really bother her, but now she can't control it and she's lost about 15 pounds. So what could be going on with Connie? Is it pulmonary embolism or heart failure, COPD emphysema, asthma, pulmonary fibrosis, pneumonia, or VALI? So this one's a little more difficult. Okay, so there's a split here. We've got asthma, a couple of asthmas, pulmonary fibrosis, heart failure, asthma, pulmonary fibrosis. Okay, pulmonary fibrosis or lung cancer. Okay, so it looks like most people think it's pulmonary fibrosis and then next asthma. So it is actually pulmonary fibrosis, and this is a lesser known lung disease. The most common way that we see, one of the most common types of pulmonary fibrosis is something called IPF, or idiopathic pulmonary fibrosis. And idiopathic essentially means we don't know what causes it. What it is a scarring lung disease, and it makes it really hard to breathe. And this is a very, very serious illness. It can't be cured, and it actually has a mortality rate that's higher than most cancers. Often from the time of diagnosis to someone passing away from it, for IPF is about 5 years. And it can be treated with oxygen. It allows you to be able to sort of, live a more full life and be more functional. What I have here is on the X-ray. You see the lungs are smaller than some of the other X-rays we've looked at, and you see all this hazy stuff. Just all the schmutz that's all around both lungs. This is the scarring or fibrosis of the lungs. So if you can imagine scar tissue building up in your lungs, preventing gas exchange, that's what we see in pulmonary fibrosis. So the way we treat it, again, going back to quitting smoking, single best thing you can do for your lungs if you are a smoker. Flu and pneumonia vaccines are key, providing oxygen, because often the oxygen levels tend to be significantly impacted and low. There is something called pulmonary rehab, which is fantastic. It's an exercise program geared towards people who have lung diseases, and essentially teaches you not only breathing exercises, but strengthening exercises that will help strengthen your intercostal muscles, your upper extremity muscles that really can impact how well you breathe. And more recent studies have actually shown that people who go through pulmonary rehab not only have an improved quality of life, there's actually now a mortality benefit, meaning that you will live longer, for the patients who go through pulmonary rehab. So as of now, there are 2 FDA-approved medications that slow the lung damage we see from IPF, but they do not cure it. And there are clinical trials that you can get enrolled in to try some newer medications, but really the definitive treatment when it gets really severe is lung transplantation, essentially getting a new set of lungs. So with Connie, she was referred to by her primary care physician to a pulmonologist, where after extensive testing, the diagnosis of IPF was made. She was started on one of the 2 FDA-approved medications called pirfenidone. She received all the appropriate lung vaccinations, so COVID-19 vaccine, the flu vaccine, and both pneumonia vaccines. And she's currently doing pulmonary rehab. With the start of the medications, her cough improved. The cough she had for 8 months improved, and now she's more active, but she is still requiring some oxygen. So situation number 6, let's see time-wise. Okay, we're doing great for time. We'll get through this one. So we have Maria, who is a 77-year-old lady. She basically presented with wheezing. Every time she cuts grass or she smells cut grass, she starts wheezing, she starts coughing. As a child, she was diagnosed with asthma, but it went away as she grew up. She feels like her chest is tight and she can't speak in full sentences. And she's been in the hospital before because of breathing problems after she was exposed to strong cleaning products or perfumes. So what could be going on with Connie? Okay, again, answers in the chat. And as you're doing that, I will take a look at some questions here. Okay. Yeah, Michelle, you've asked, what does pulmonary fibrosis and working on a cruise ship have to do with it? That's a great question. So often on cruise ships, there's asbestos. And so people who've been in the Navy or working on cruise ships for decades, that increases the risk of causing pulmonary fibrosis because asbestos is one of the known risk factors. Asbestos exposure is one of the known risk factors for it. Marlene asked, can long-term cocci or valley fever cause lung scarring? Cocci is a fungus that's in the environment. It's native to California and most of the West, and it can cause a pneumonia. Long-term, you can see scarring in some patients, but most people have an acute pneumonia and get better from it. Are they types of pulmonary fibrosis we know the cause of? Excellent question, Elliot. Yes, they are. There's a large variety of pulmonary fibrosis that are actually caused by autoimmune diseases such as lupus, such as rheumatoid arthritis, such as, for example, sarcoidosis. So there's a list of other types of pulmonary fibrosis, of which IPF is just one. Julie asked, is this the same as ILD or interstitial lung disease? IPF is a subtype of interstitial lung disease. Interstitial lung disease is the general bucket that we put the pulmonary fibrosis diagnosis under. Great. So going back to our answers, it looks like it's almost 100% asthma on one VALI, which is correct. So what's going on with Connie? Pulmonary embolism, heart failure, COPD, asthma, pulmonary fibrosis, pneumonia, or VALI? The answer is asthma. What Maria's having is essentially an asthma exacerbation, essentially where she's having symptoms of asthma, she's wheezing, she has noisy breathing, she's coughing, she feels tightness in her chest, and she is short of breath as well. So the symptoms range from being mild to severe, and in some cases, it can actually lead to death. When we talk about asthma, we're talking about inflammation of the bronchial tubes or bronchioli. What you see here is a nice open bronchial tube on the left side. And you can see a muscular layer surrounding it. And when it becomes inflamed, the muscular layer hypertrophies or thickens, and you can see how much this airway has narrowed down. So you have a hard time getting air in or out. So Maria was referred to a pulmonologist. She had a breathing test that confirmed the diagnosis of asthma, and she was started on a quick relief inhaler in addition to a controller inhaler. She has an asthma action plan, which essentially tells her which medications to use every day at home. We call these controller or maintenance medications, and which medications to take when her symptoms get worse, and when to get help or call for an ambulance. Because asthma is a very treatable condition, but when people die from it is when they are having these flares or exacerbations where the airways tighten up, narrow down, as we saw in the other picture, and they are not able to get air in and out. And then last but not least, situation 7 is Manny. It's a very sad situation, and it's someone I saw in the clinic in the hospital. And Manny is a 17-year-old high school student. He was very active on the basketball team, and he vapes every day with his friends. And more recently, he started noticing his chest was tighter, and he wasn't able to run up and down the court as he normally would, just because he was getting out of breath. It was getting harder to breathe. So what could be going on with Manny? Is it pulmonary embolism, heart failure, COPD, asthma, pulmonary fibrosis, pneumonia, or VALI? And answers in the chat again. Okay. Yeah, it's mostly VALI here. Okay. Yeah. And that's the correct answer. So VALI or vape-associated lung injury. And the way we diagnose this is that you've used an electronic cigarette in the last 90 days and you present with shortness of breath, cough, a tight feel in the chest, or fatigue. And it can range from mild symptoms, which are self-limiting and often reversible once you stop using the vape, to severe symptoms, and in some sad cases, even death. So he was admitted to the hospital. His oxygen levels were profoundly low, actually in the 70s, which is very, very low, but being young and otherwise healthy, he was actually walking around with really low oxygen levels and didn't realize it. We tried giving him supplemental oxygen. He wasn't doing well with that. Eventually, we had to put him on life support on the ventilator. He was on the ventilator for 4 weeks. And during that time, he developed sequential multi-organ failure, one organ failing after the other. And eventually we had to have a conversation with his, with his family. And his heart eventually gave out and he ended up succumbing to VALI. So this is a rare situation that it happens, but it is a serious situation. And there are a handful of cases that have happened nationwide where young, otherwise healthy people have died from this. So a lot of people, especially young people, think vaping is a benign thing to do and it doesn't cause any problems. There's this perception that it's a natural compound that you're taking in. Far from it. If you see the images I had shown earlier, these are heavily targeted towards young people. You can see the bright colors. Often they do them in candy flavors or strawberry fruit flavors, that sort of thing, that make it really enticing for young people to use. And it becomes quite difficult to quit, especially the nicotine-containing ones, because the actual amount of nicotine in them tends to be higher than the amounts we see in cigarettes. So it makes it quite difficult to quit. So with regards to quitting, the first thing you want to do, if you yourself vape or someone you love vapes, is encourage them to not vape. Just putting it down or getting rid of it altogether, and then staying busy. Occupying yourself. There's certain situations or things that you'll do that trigger you to vape. So avoiding those triggers, and then asking for help. Let people around you know exactly what's going on that you're trying to quit. And then that way you can have a supportive environment as well. And then rewarding yourself for days or hours that you go without vaping as well. And then someone had asked earlier about cannabis. With cannabis smoking, again, there's a perception that this is a benign thing to do and it doesn't cause any problems. There are some risk factors associated with cannabis smoking. In the short term, you can have cough, wheezing, increase in your sputum production. And then in older adults, we're actually seeing increased risk of heart attacks and low blood pressure. In the midterm, you develop obstruction in the airways, which is what I described earlier, atrial fibrillation, which is the abnormal heart rhythm. And we tend to see poorer dental health in people who smoke a lot of cannabis as well. So if you're someone who really cares about your teeth, you want to avoid this. And then long-term, we see psychological disturbances, especially in young people, adolescents who have brains that are still developing. We see an increased predisposition towards bipolar, schizophrenia, and other mental diseases, other psychiatric diseases as well. So it is far from a benign thing to do. So just to wrap things all up, tips to help improving your lung health. So the one message I've said over and over again is stopping smoking. My general tips to my patients is that if you can see the smoke, it's generally not good for your lungs. So whether it comes in the form of an e-cigarette with vaping or a cigarette smoke, hookah, you don't want to do any of that. As much as possible, trying to avoid environmental exposures, and then vaccinating yourself as well. The COVID-19 vaccine, the influenza vaccine, pneumonia vaccines, these are all vaccines that can protect your lung health long-term. Exercising frequently. All the other organs around your body, exercising them. And then as much as possible, trying to maintain a normal weight is really key. So these are some general tips, and thank you all for your attention. I know we have other questions in the chat, but I am also being very mindful of the time we have here. So I'm going to pause. And Kristen, I don't know if you wanted to say a few words there.
I would just like to thank you so much for your time today. This was very informal. So many people have questions about lung health, especially with the pandemic, COVID-19, the vaccine. So thank you so much for taking the time out of your busy schedule to discuss this important topic and answer all these lovely questions coming through. As you can see, many people are very interested in this topic with all these questions. So thank you again for your time. And I would like to thank all the participants for attending. And I just wanted to mention just a friendly reminder that we do have our webinar next month on Wednesday, November 17th from 12 o'clock to 12:45. We will, the topic is diabetes prevention, don't sugarcoat it. So we will discuss the harmful effects of too much sugar, the sugar pathway to the body, sugar marketing tricks, how to be a sugar sleuth, so find hidden sugars in some of these products out there, and learn ways to curb sugar cravings. And that is it for me, Dr. Chima-Melton. Thank you once again. I really appreciate your time. Thank you, everyone. Have a wonderful day.
Thanks, everybody. Bye-bye.